Welcome to Brain Info Live, for everyone in the brain health community. Brain Info Live is about hope, health, support, education, and you. Whether you're living with Alzheimer's or a caregiver, family member, or loved one of someone who is, Brain Info Live is here for everybody.
Good morning, good day, everyone. My name is Barbara Chandler, and you have just tuned in to Brain Info Live. And I did say live. This is our 12th session, and we will be discussing the relationship between dementia and diabetes. For those of us who are in Florida right now, we are hoping that everyone is safe and prepared. We do realize that Hurricane Ian is upon us, and we just wanted to make sure that we were also being consistent in bringing you information. But the first priority is that you and your family and your loved ones, that they are safe. So we are keeping that in consideration. We have a very special guest, of course, with you joining us today. She is the friend of Brain Info Live. It is Dr. Naushira Pandya, and she's going to be discussing again the correlation between dementia and diabetes. But of course, first, and you know by now, we take care of business around here, and that business is with none other than John Lewis, better known as J. Lou, our fitness guru. He's going to do our 5-minute chair exercise. And as we always say, go at your own pace. Okay, this is not a competition. This is for you. Make this 5 minutes work in your best advantage. We want you to stay healthy. We want you to be active. But most of all, we want you to be safe. So up next is J. Lou, our fitness guru.
Hey, I'm J. Lou, your fitness guru. I want to welcome everyone to Brain Info Live. Today we're about to go berserk, cosmic style. So in 5 seconds, get your dumbbells, a comfortable chair, and let's go. 5, 4, 3, 2, and 1. Let's go.
All righty, so that was J. Lou, the fitness guru. And as always, we hope you made the best out of that 5 minutes. The music was so enjoyable. What a great, intense upper body workout, a lot of arms. And we're always using those upper body parts to move things. So why not keep them fit? Keep it nice and tight. Once again, my name is Barbara Chandler, and you are listening and watching Brain Info Live. I am here in Florida. Normally, I would say sunny Florida, but right now we are in preparation. We are hunkered down as the hurricane is upon us. And Brain Info Live team wants everyone to be safe. We want you to be prepared, of course, with all the necessary supplies and items that you need to get through these next couple days. Pardon me, today and tomorrow. This particular topic today is about dementia and diabetes. We have, of course, with us Dr. Pandya, and she is going to be discussing the relationships of those two. But right now, as usual, it is time to go to the movies. We're going to do our movie segment, and this is from UCLA. It's about the lack of eating and how caregivers can manage meals for older adults. Okay, so this particular segment, what you're going to see, video segment, what you're going to see, it is about the lack of eating and how caregivers can manage meals for older adults.
Tell me about your father's eating problem.
Food was always important to my father. He was an extremely successful businessman, but he was always home for dinner, except when he was traveling. I remember him coming home and my mother would always have a big meal waiting for him, beginning with a scotch and appetizers. Dinner would last hours until I needed to do my homework and go to bed. He was so happy, his family beside him in a big supper. As his Alzheimer's disease progressed, Dad became less interested in eating and began losing weight. I could still get him to drink scotch and wine when we sat down for dinner, but he wouldn't touch his meal other than a few bites and only when we prompted him.
What did you do to try to help him?
As he began to lose weight, I asked his doctor about appetite stimulants, and he said there weren't any that are safe and have been proven effective for persons with dementia. So I asked about medical marijuana, and although he said there is some evidence for it stimulating appetite in AIDS patients, it hasn't been studied in persons with dementia. He said if we wanted to try it, that he was willing to write a prescription. I had to laugh because Dad was so anti-drug when we were growing up, and now we were going to be getting him high. So we tried it, but unfortunately it didn't work.
Did the doctor have any other suggestions?
He looked at my father's medications and stopped one or two that might contribute to decreased appetite. That didn't help either. Finally, we talked about Dad's diet. First, the doctor had us taper his alcohol, substituting alcohol-free wine and beer. The doctor also said that because of his Alzheimer's, the benefit of a low cholesterol diet wouldn't be much. He also said Dad's diabetes wasn't that severe, and new guidelines allow for his blood sugars to run a bit higher, so we allowed him to eat foods he likes more. Now, that helped a lot. He really took to gelato. And it's funny, once he began to eat, he started eating more like he remembered that he's supposed to eat.
Was there anything else you did?
The doctor also suggested that we take ownership of his eating and not rely on Dad to take the initiative. It was basically providing closer supervision to make sure his meal was set up and he knew he was supposed to be eating. Sometimes we needed to remind him every few minutes to take a bite of food. And the doctor also advised us not to force him to clean the plate every meal. Rather, he said give him between meal snacks. We began with supplements from the store, but found milkshakes worked just as well, especially if we mixed a banana in. Dad began to gain weight, and we don't need to give him the snacks anymore, except of course on special occasions.
Is there anything that you would have done different?
We probably would have mentioned the problem to his doctor earlier and not waited until he was losing weight.
Do you have any advice for others?
Although the getting food in Dad crisis is over, his eating's not back to usual. Instead, it's a new normal that we needed to adjust to. Meal times aren't the same, but things are definitely better, and I worry a lot less about his eating.
Hi there. Welcome back, everyone. That was a great segment. And here with us is Dr. Pandya. Dr. Naushira Pandya is a professor and chair of the geriatrics department at NSU Karen C. Patel College of Osteopathic, am I saying that correctly? Medicine, and the
Osteopathic.
project director. I'm sorry, again?
Osteopathic.
Osteopathic, thank you. Osteopathic medicine and the project director of the HRSA funded NSU South Florida Geriatrics Workforce Enhancement Program. She is board certified in internal medicine, geriatrics, and endocrinology and metabolism, and is a certified medical doctor for nursing homes. Dr. Pandya is a past president of AMDA, the Society for Post Acute and Long Term Care Medicine. She's participated and led she's participated and led in the development of multiple clinical guidelines and position statements, and is recognized for her work in the area of diabetes in the elderly. Dr. Pandya holds the distinction of being a Fulbright Senior Specialist Scholar. She is a great friend to Brain Info Live. This is the second time she's with us, so we definitely want to give you a very warm welcome. Thank you so very much for being here with us.
Thank you, Barbara. It's a great pleasure to be here again. And thank you for inviting me.
Absolutely. That was a very interesting video for so many reasons in watching it. And I'm sure you're going to help us to digest this because we're not thinking of Alzheimer's, eating habits, and the links to diabetes. So, explain to us exactly what we just saw.
Yeah, I really enjoyed watching that video too. And this is such a common problem. And we see this in our clinics and in our nursing home population. As people develop Alzheimer's or other forms of dementia, the appetite is suppressed, and interest in food, enjoyment, concentration with a set meal suffers. And weight loss is very common, and that can be detrimental because you're more prone to infections, you lose muscle, your immune system declines, you're more prone to falling. So what was illustrated there was liberalizing the diet and looking at factors that could impair the appetite. And some medications do that, and the doctor approached that. Also, the family was, very careful about low cholesterol and low fat diets, as we do when we're in, young and middle age. But what we do know is in older adults, diet should not be restricted. And even food consistency, softer, easier food with more sauces, more taste, is beneficial. And older people with diabetes should have what I call a real food diet. They should just eat real food that they like. And as
Wow.
the gentleman mentioned, our professional guidelines do recommend less tighter blood glucose control for older people with diabetes because the research has shown that very tight control that you would use in younger adults is not beneficial.
Oh, okay. Okay. Wow, that was interesting. So we got a few questions here. The first one says, when we say diabetes and dementia, is it type 1 and 2 or just one of the types?
So the most common type of diabetes in this country is type 2 diabetes, which is associated with overweight, genetic tendencies, lifestyle. Eventually, those patients may need insulin. Okay, but it's not our first line. And type 1 patients need insulin right from the beginning. They're dependent on insulin for treatment. But actually, both types of diabetes are associated with dementia or some form of cognitive impairment. And now, don't forget, Barbara, patients with type 1 diabetes are also living longer. They're living into the Medicare age group and older, whereas we didn't see
Oh,
that before.
wow. That's really good to know. That's really good.
Mhm.
One of the things in the video that stuck out to me is when the son stated that he took his father to the doctor and they tried the prescription marijuana. Was it
Mm.
to have him to smoke it and see that would he get cravings? Was that the reason for that?
I think overall that was it, and to see if his appetite would increase. Because what his father had was anorexia, loss of appetite and interest in food, and many conditions in older people and younger people, can cause that. Um, and certainly in cancer patients, we use a medication called Marinol, which is derived from marijuana to stimulate appetite, to reduce nausea, and it kind of generally improves the well-being of cancer patients. And as you rightly said, the doctor was willing to try it in this patient. It's not officially approved, but certainly,
Okay.
with discussion and appropriate documentation, this can be done.
Excellent, excellent. Okay, can we talk about hypoglycemia, insulin, and the role they both play when we're speaking about dementia?
Yes. So let me just first explain hypoglycemia, which is low blood sugar. So this is the terminology for low blood sugar. And generally, blood sugars lower than 70 milligrams per deciliter are considered hypoglycemia. More significant hypoglycemia is less than 54 milligrams. And then there's this condition called severe hypoglycemia, which can be any level of blood sugar where the patient cannot get themselves out of trouble. They need to they need help from an outside person. They can't reach out for the juice or eat the candy in their bag or ask for help. They deteriorate very quickly mentally and physically, so it takes an observer to help them out. So that's severe
Ah,
hypoglycemia. Now, hypoglycemia can occur with all forms of diabetes treatment. People who are on insulin and certain diabetes medications in that group called sulfonylureas, they can increase the risk of hypoglycemia more. That's not to say these are bad drugs. I mean, you need medication to get your blood glucose down, right, when it's very elevated in people with diabetes. But you have to watch how low is the blood sugar going. And if it's too low all the time, and patients may not be aware, they may not have those symptoms of sweating, fear, this gnawing hunger, a tremor that alerts them that their blood sugar is low. So over treatment is still common in older people. We tend to get the blood sugars too low at times, and that can be
mm,
detrimental to brain function. And repeated episodes of hypoglycemia have been shown to be associated with impaired, brain function and cognition, increased incidence of
right.
dementia. We have repeated episodes of hypoglycemia.
Wow, wow. You know what I'm thinking of the caregiver in this instance. I'm thinking of the caregiver, the day-to-day caring of the person living with dementia, and now they also have to watch for all of these other things in which we're
Yeah.
speaking about. So we definitely want to give a shout out to the caregivers. This is never an easy role. I mean, it's one thing dealing with the diagnosis of dementia. But then when you start to add on these other complexities, that caring definitely takes on a different form each time.
Yes, caregivers play a huge role not only in the care of dementia patients, but managing all these comorbid illnesses. and the medications, the complexity, the devices, the administration of these medications,
Yeah.
not to mention the medical follow-up. I mean, caregivers really need our gratitude and a lot of
Truly.
kudos, because they provide the majority of caregiving is provided by unpaid family or other caregivers in this country.
Okay. I'm sorry. Someone's coming in. I don't want them to disturb us. The next question says, I'm sorry, the next one says, other than high blood sugar, what are some other diabetes factors that affect dementia?
Yeah, so diabetes doesn't just come as a single problem, unfortunately. So it's not just a high
Mhm.
glucose problem. I often say, and certainly my experience has borne that out, that people with diabetes have a head to toe disease. There's almost nothing that
Mm.
diabetes does not affect in the body. And so people with diabetes are more likely to have hypertension. They're more likely to have high cholesterol levels, and some related to poor control, but sometimes it just goes with the territory. And so they're more likely to have cardiovascular disease, hardening of the arteries affecting the brain, strokes, mini strokes, TIAs, heart attacks, circulatory problems in the legs, kidney failure. So all that is due to cardiovascular problems and the poorly controlled diabetes in general.
Wow. And I guess that goes to the next question. Should people go on very healthy diets to combat these things?
Yeah, so the first thing I want to say is that this is not a blame situation. Okay. When you have
Okay.
a diagnosis of diabetes, it's not your fault. Okay. But you have some predisposition. It may be in your family. It may be related to weight or your activity. But so some of that can be improved. Lifestyle can improve and reduce blood glucose levels. And if you're in the very early stages of diabetes, such as pre-diabetes, lifestyle changes and weight loss could actually bring you back into the normal range of blood glucose levels. So while diet, exercise, change of lifestyle can help, sometimes the type 2 diabetes is a progressive disease, and over
Mm.
time the pancreas is able to produce less and less insulin. So I tell patients that over time you will need more treatment. We can slow this down by controlling your diet, especially the carbohydrates in your diet, by doing at least 30 minutes of exercise 5 days a week, which is the general recommendation, including a couple of times of weight-based exercises. That can help. A Mediterranean diet could help as well, and that has been shown to improve uh, cognition in dementia patients. Okay, and actually reduces the risk of dementia. A Mediterranean diet, all that helps. Good control of blood pressure is essential, especially in midlife. Even when you don't think you're doing that badly, you need to control your blood pressure and also keep an eye on your cholesterol levels. There are plenty of good treatments for that in addition to diet.
Correct, correct. Wow. And thank you for stating that. It's not a blame, no shame
Yeah.
is what we always say. A lot of these things we do inherit genetically, so it's good to hear that, because I think a lot of people may think that they have done something wrong, their
Yeah.
weight, their eating habits. So thank you so much for saying that. And once again, in just about every segment that we've done, the consistent theme has been nutrition and exercise. Those are things
Mhm.
that can, as you say, kind of bring you into balance. We don't want to say that those are the cure-alls, but those are
No.
definitely things that can slow down the progression. So that's been very consistent. I think the only time it may not have been stated is during the driving one, but otherwise than that. We have another question here. This is actually coming from the audience. it says smoothies are are smoothies recommended for dementia patients? Should other foods be simple to ingest? I hope I'm reading this correctly.
think I get the gist of that. Yeah, smoothies
Okay.
are good. People who don't eat well and patients with dementia, and even as you get older, I mean, think about it. If you think about your grandparents or your parents, can they finish a big meal like you can over Thanksgiving or Christmas? They
Yeah.
can't. They won't finish all three courses necessarily. So appetite goes down as you get older. So in between meals, if you give milkshakes, that also adds to the caloric intake, increases your calories. They're tasty. You can put all kinds of things in smoothies. You can make them at home. Some people buy Ensure and other nutritional, liquid supplements. It's not always necessary to do that if you can make healthy smoothies, even with a scoop of protein powder, with an egg, you know. So you can actually make very nutritious meals and snacks. Some people in advanced stages just want liquids, so a smoothie can be a great meal if you add, the protein. The other thing that helps is finger food. So
Mm,
patients with dementia might not have the dexterity and the patience to use a knife and fork, or the food might can be cut up for them. So don't make it complicated. Don't make it too fancy. Appearance is important, very important. Color is important. Okay. But finger foods seem to go well. Patients like that. They have some autonomy and enjoyment. And you need to have patience when you're supervising or helping an older adult with meals. You need to have time. If you rush a meal, they won't get enough to eat.
wow. Wow. That's really good. And that makes sense. I hear less is best. Less is best. Keep it light, keep it fun, keep it interesting.
Yes.
Don't
Mhm.
overcomplicate it for the
No.
person. Yeah, yeah, that's really good.
And
Let's
it's
see
a
here.
bit
We
like
have another
children.
one.
It's a bit
Yes,
like, children, right? Some music, some chit chat, a little bit of
yes,
distraction. It helps them to eat more. And so
yes.
I think certain music, conversation,
Okay.
socialization is important for older
Yes,
adults.
yeah, yeah. Excellent. That's really good. Um, the other one says, if I already have diabetes, can I still lessen my risk for dementia? If so,
And
how?
very important. And that is a great question because I'll just kind of set the stage, to our initial discussions with this session uh, and why I thought it was important. We know that people with type 2 diabetes do have a global decline in cognition. They're almost twice as likely to have cognitive problems, dementia. It can be Alzheimer's disease, but it can be vascular dementia due to circulation problems, strokes, mini
Mm,
strokes. And so, yes, you have the disease. You can work with your provider, your physician, your practitioner to make sure that your blood sugars aren't too low. All right. Because
right.
as I said, hypoglycemia and repeated episodes of hypoglycemia can damage the brain, to put it very basically, and impair cognition. It can affect, your memory for events, your memory for facts and figures, and it can even
Mhm.
affect your executive function. But at the same time, overly high blood glucose levels, poorly controlled diabetes is also associated with dementia. Okay, twice the risk.
Mm,
So you cannot be too low and you cannot be too high. And the goal, what is the appropriate goal for each individual? And that has to be decided with the practitioner, hopefully following some of
yeah.
the guidelines that are available. So very high blood sugars over a period of time can affect you, and very low blood sugars. So it all, and at the same time, not only glucose control, but blood pressure control, cholesterol control, monitoring kidney function, all those things will affect cognition.
I see. I see. And it's balance. I hear balance, and I always have a friend who says, balance is hard to attain. So what you're trying to find is harmony in everything. So,
Yes.
but yeah, yeah, yeah. Not too much, not too less. It's finding what works for that patient, work for that individual, and make sure that you do these things. Alexa, do
And
we have any more questions from the audience? I'm sorry, doctor.
no, no problem. Happy to answer any more questions.
Okay. I think we're
Okay.
okay. Wonderful.
What I
If
wanted
there
to
is
say,
one,
sorry, Barbara, what I wanted to say is that, goals, diabetes management can be individualized. And this is in discussion with your practitioner. And it can also, you need to have your say. Like, you can say, well, I'm not ready to go on 3 shots of insulin. Like, is there something else? And there are treatments now that might make it easier to manage people with diabetes. Um, I'm tired of doing finger sticks, and we have continuous glucose monitors now um, that can, obviate the need for doing finger sticks. So those are approved for people, who have diabetes, who are doing frequent 3 or more shots of insulin. They might be on an insulin pump. You might need to adjust their insulin and other medication treatments frequently because they're not well controlled. And they need to see their doctor on a regular basis. So for those people, these continuous glucose monitors are approved, which can really change your life if you think about all the multiple finger sticks that you have to do and the discomfort. And also, it tells you at any time of the day or night what your blood sugar is. It can be set up to alarm
mm,
if you're asleep, and if your blood sugar is too low, it'll wake you up. Or
it'll wake you up.
if you've had an excess of carbohydrates at a big dinner, you'll know how high your blood sugar is. And so the
Right.
low and
Right.
high alarms are set. It gives you feedback. And it's really been shown that people change their lifestyle in response to all this information they're getting all the
Mm,
time about their blood sugar. And even family members can carry the apps on their phone. So even if their loved one is at home, they know what's happening to their blood sugars if they're alone.
mm. Exactly. And it's almost become it's teamwork. It's actually teamwork at that point. Yeah, to make sure that person is well. Okay, anything else? If there was one thing you would like to leave us with, the audience with, what would that one thing be at this time?
I think my main recommendation would be to individualize the treatment, uh, all the medications and the lifestyle treatment to suit that person and to simplify the treatment. That would be my main recommendation. Don't make it too complicated, but maybe too many shots, too many medications, too many glucose checks. If you can manage it without doing that. And now we have technology to help us.
Wow, wow. And I think what you just said is so applicable. Make it manageable. Make it with
Mhm.
customize it. If you find
Exactly.
a
Yes,
system, right, customize it. Find this
absolutely.
system, of course, with the doctor's input, nothing too much, nothing too less. But if you see that it's working, it's stabilizing the individual, it's easy for everyone. It's doable, and not never easy, but it's doable for everyone. And as they say, make it make sense. Make it make sense. So
Yes,
I think that's yeah, yeah, that's and that seems so applicable to me. So thank you so much once again. This knowledge, I just think we're lucky that we can have someone like you in our community who can disseminate this type of information in a very relatable manner. So thank you once again, Dr. Pandya. Thank you for joining us. And please stay safe. Please stay safe.
thank you. You're so welcome, and it was a great pleasure. Thank you.
All righty. All the best. All righty. Thank you once again. Brain Info Live here in Florida, our 12th session. Barbara Chandler. I'm Barbara Chandler. That was Dr. Naushira Pandya. And she spoke to us, and you heard the wrap up. It's dementia and diabetes and the relationship. And the one thing she left us with, and it's just been so consistent, if you go back through our 12 sessions, maybe excluding driving, one of the things, and finance, maybe excluding driving and finance, one of the things that they speak about diet and exercise, finding that harmonious balance for that person that is living with dementia as well as any other illnesses that may be diagnosed. Find what works. Keep it simple. Keep it simple for not only the caregiver, but the person that you're caring for through diet, through nutrition. We talked about the smoothies, talked about the smart snacks, just finding something that works, not too much, not too less, but right in the middle that it's able to sustain. It's able to sustain, it's able to be managed, and the person also gets to be included in that wellness plan. So we always want to thank Dr. Pandya. This is her second time speaking with the Brain Info Live audience, and she's just a wealth of information. We're going to move on. Let's see what we have. We have our poll. As usual, we have a poll, okay? This is how we test ourselves. This is our self test. And we're going to bring up the poll really quick. There it is. If you live with dementia and diabetes, you must have a very strict, healthy diet. Okay? True or false? If you live with dementia and diabetes, if you're caring for someone with dementia and diabetes, they must have a very strict, healthy diet. All right? And the answer is, I never do a good drum roll. The answer is false. And we heard that today. Again, I think our takeaway word today is balance. We have to find the balance. We don't want to take away and or feel deprived. I think that's the word. When you take away everything, you start to feel deprived. And when a person starts to feel deprived, they want it even more. So we want to find we want to find a healthy diet. We want to find a healthy lifestyle. She talked about the smoothies, making smoothies on your own with the things you have in your home already. Finger foods. I love finger foods, whether it's chips. And she also talked about socializing during mealtime, whether it's with music, conversation, chit chat. Those are things we can do. Those are things that we are already doing. Okay. I love the finger foods. There's the carrots. There's the little peanuts. Of course, let's not do peanuts if anybody has a peanut allergy. But again, these small grapes are always fun to eat. Okay. So we want to find the balance. That is the takeaway word for this section. This session is finding the balance, not too much, not too less, but we're finding what works and what we can maintain. All righty. So, guess what? It is time to talk about our resources. I believe in resources. If you know me, I believe in having resources handy. You never know when you're going to need them for yourself. You never know when you're going to need them for a neighbor, a loved one. So, resources, we want to introduce some of our national and local resources when we're speaking about diabetes and dementia. All right. We have on the national level, Harvard Health Publishing. What's the relationship between diabetes and dementia? We also have AARP. AARP is a long-standing organization within our communities. 7 steps to take after diabetes is diagnosed. Over medication of diabetes can cause health problems. The surprising link between diabetes and hearing loss. Check out the AARP for more information on that. Advent Health Orlando, very familiar with Advent Health. That's a Florida resource. Caring for Diabetes and Unique I can't see the other word, but I do see where it says Caring for Diabetes and then Unique Challenge. Once again, these are the resources. Okay. Caring for Diabetes and Dementia. Thank you. A Unique Challenge. Thank you so much, Alexis. Alrighty. If you have not signed up with us, always, this is a perfect time in which to do so, in which you can continue. There it is right there. Continue to receive information from us. Join the Brain Info Live mailing list. This is where you can add to your repository of resources. Okay, if you have information or if you would like information, this is where you can sign up. All right, bit.ly/BIL sign up. This is where you can sign up with us. All righty. Once again, we want to thank everyone, every single one who's been here with us. Again, for those of you, we are in Florida right now. Hurricane Ian is approaching, depending on where you are. I know it's covering a lot of territory. We want our caregivers to be safe. We want our families to be safe. We want the people and the loved ones who we're taking care of to be safe as well. By now, everyone should have their necessary supplies. Everyone should have a list of places if you have to evacuate. I know that you have a plan in place. I know you have a plan in place. I'm confident that you have a plan in place in case you and your loved ones have to evacuate. All right. We just want to thank you. We want to thank Dr. Naushira Pandya. And we also want to thank our fitness guru, John Lewis, aka J. Lou. We also want to thank the Brain Info team for all the work that they're doing in making sure that they bring us some of the top professionals in the industry that can share this valuable information with us. We want to thank the people in the background for making this video so wonderful. And for most of all, we want to thank you, those who are watching us. And we certainly appreciate you, and we look forward to seeing you again. Until then, we say stay safe. Thank you so much.